Good afternoon, or good morning, or good evening. I know we may have people from all over, so I am so excited to be with you all today for talking about rethinking disability, inclusive and accessible strategies for organizations and programs. I am pleased beyond belief to be with ARCA today. I am a I use she, her pronouns. I am the Senior Director of Community Education for Able, South Carolina. I am going to demonstrate an example of what all organizations and presenters should be doing in their presentations, whether they are on webinar or live in person. You don't want to assume who may have disabilities in your audience. And so you could have people who cannot see the visual on the screen. So it's important to describe those visuals to people. So on the screen, I have a picture of me. I am a white person with blue eyes. I have short brown hair. I'm wearing a blue flowered dress. It's navy blue with pink, yellow, and green flowers. I am sitting in my power wheelchair, which is black, silver, and blue. And I am sitting outside with greenery in the background. I am proud to tell you all I am also a person with a developmental disability and a physical disability. I am also equally proud to tell you I have a counseling background as well from Johns Hopkins University. So I am pleased to be with you all here on a variety of levels, not just as a professional who teaches about disability, but as a person who lives it every single day. So thank you all for being with us. I'm so glad to have you all with us. So we talked about that I am from Able, South Carolina. Who is Able, South Carolina? Well, we are the largest federally recognized disability led organization in South Carolina, seeking transformational changes in individual systems and communities. We've been around since 1994, and we've remained a consumer controlled, community based, cross disability nonprofit that is working to make South Carolina a national model of equity and inclusion for all people with disabilities. More than 3/4 of our staff are people with disabilities, as are over half of our board of directors. So we have a saying, we are the people that we serve. We practice co-equality, disability justice and representation, and true inclusion through fostering consumer-driven independence and disability pride. We didn't just learn this as people with disabilities. Our work doesn't end when we leave the office. Disability is a proud part of who we are, a proud part of our identity, and we live it every day. At Able, South Carolina, we have a three-pronged mission. We're an organization of people with disabilities leading the charge to equip people with disabilities to foster pride and to direct their own lives. We're teaching people in our communities, and here we're working nationally and internationally. We do a lot of work in other countries as well to educate the community, to challenge stereotypes and eliminate barriers. And we advocate for access, equity, and inclusion at the individual, local, state, and national level. And when we put all that together, we're a South Carolina that's a national model of equity and inclusion for all people with disabilities. And at the bottom of your screen, I have a picture of all of our staff, our interns as well, who are representative of what we're asking for, not only in South Carolina, but nationally and internationally, that we're truly integrated. So we have staff without disabilities. We have staff with disabilities that are visible, that you can see, like mine. I use a powered wheelchair and a service dog. And we are a staff of people who have invisible disabilities as well. So why am I even here today? What are we going to talk about? Well, I'm excited because we're going to talk about what is disability and how does that definition of disability and understanding disability impact our work as counselors, rehabilitation counselors, folks who are helping individuals to recognize their own goals and to lead the charge themselves for what they want in their lives? We're going to talk about disability culture. We're going to talk a little bit about bias and marginalization. We're going to talk about what are the top barriers for people with disabilities to utilizing counseling services, utilizing community services in a wide variety of subject matter. We're going to talk about ableism, a national and international term, like all the other isms, examples like sexism, and racism. Ableism is a real thing. Language and identity. We're going to talk about different types of language to use when working with the disability community and how that influences our identity as individuals with disabilities in our communities across this country and internationally. We're going to talk about, I'm going to talk to y'all about a summit that we just had here in Colombia to change the way employment is viewed and employment of people with disabilities. And then I'll answer any questions along the way that anybody has, but I'll leave some time at the end. And I also provided to ARCA the PDF of the PowerPoint and some supplemental handouts that go along with this presentation that they will be emailing to everyone after the presentation. So in case people had questions, yes, you will get a copy of the information that we're talking about today. So we can't go anywhere with this presentation unless we're all on board with what is disability and what does disability look like, how is it defined, and how does it impact the work that we do as professionals in the counseling arena. So here's our first opportunity to participate, and I'm going to let you all either unmute yourselves or put it in the chat. I have a picture, it's really a collage of people with disabilities where I live here in South Carolina, of all backgrounds, all cultures, all ages, all socioeconomic statuses, that have disabilities. Some you can see that it's apparent they have a disability, or some you cannot see because they have invisible disabilities. So I would like to start out this whole presentation with either people you can unmute or put it in the chat. What does it mean to have a disability? When we talk about that, what does that mean to you? What does it mean to have a disability? Whether that's for you professionally, does it have a connection to you personally? Do you work with people with disabilities? Do you do recreation with people with disabilities? What does disability mean to you? I'm going to let Taryn tell me if there's anything in the chat. If anyone would like to unmute themselves and share an answer, I am all about collaboration and hearing from people. So what does it mean to have a disability? I'm letting them come in, Taryn, because sometimes we all need a minute or two to process. Me too.
We have a few in there now.
Plus, for some of us, you all may have been eating lunch or just had lunch, and I know that can be, the lunchtime can be impacting too.
Is it okay if I say something verbally?
I would love it, Allie. It's nice to meet you. I'm Dori.
Hi. I feel like one thing that strikes me is that disability can be both like a political identity. I mean, maybe political isn't the best word, but it's like, an identity that you claim as your own, or it can be an identity that people put on you via
Awesome.
labels, like, that you experience throughout your education, that kind of thing. So it's like, can have a dual meaning.
I like that. Good. Anybody else want to unmute themselves, and then we'll go to the chat. And the reason I'm talking about this is for a lot of people, this word means a lot of different things. It can have positive associations and negative associations. So I'm interested to hear from your perspective as both a role as a professional, and maybe for some of us like myself, you do not have to disclose, but I proudly disclose I'm a member of the disability community. I'm a member of the disability culture, and those are things I myself claim because I am proud of both of those things.
So
You
do
want to
we?
share any in the chat, Taryn? And then
Yes.
if anyone else decides they want to unmute, we will let them.
Yes, we have a few over here in the chat. So we have meeting unique physical and or mental challenges. We also have the need for accommodations due to mobility. Another one here with the similar theme of having unique challenges, people with different abilities. And here's one that says, I have disabilities, work with people with disabilities, and teach students how to work with people who have disabilities. I am defining disability as a significant health related difference.
Thank
Um,
you. And thank you for embracing those and sharing too that you're someone who not only works professionally with people with disabilities, but you too have one as well. Um, Thank you. Is anyone else added anything else, Taryn?
yes, we have a few more here. Labeled by medical or mental health professionals, and it can mean experiencing the world differently. There is a need as a provider to have an open mind and consider all options that could help someone. And then we have another chat here that says, I have disabilities and my son does as well. I work with people who have disabilities, and for us, it means we are more resilient.
Love it. Woohoo. All of those answers were fabulous. I should have warned y'all I bring a lot of energy. So I hope everybody's ready. All right. Great answers. I'm going to share with you how disability is defined not only by the Americans with Disabilities Act, but the ADA. It is also defined this way under federal law, the Rehabilitation Act of 1973, as well as other health related laws that we utilize every day in the course of our work. So the law defines disability as a substantial limitation in being able to perform one or more daily living activities. So a lot of people hear that, and what do they focus on? The two words in the middle, substantial limitation. The law isn't saying that people with disabilities can't do these things. The law is saying people with disabilities are afforded the right to reasonable accommodations. That's the legal word. Reasonable accommodations or supports to perform those daily living activities. Now I'm going to see if y'all are still awake. Who can share with me what are some daily living activities you've done already today before coming to this training? What are some daily living activities that you've done before coming to this training today? You can either put them in the chat or please feel free to unmute yourself. I love getting to know new people and having dialogue. So, what are some daily living activities y'all did before coming here today?
But as some of the people are kind of thinking and coming off mute, I'll let you know what's popped in the chat here. Brushing my teeth, eating lunch, showered, making coffee, getting dressed, got kids ready for school, fed the dog, got dressed again, did my morning hygiene routine, and drinking coffee.
Awesome. Anybody want to unmute and share any? I know I'm encouraging people to. I know we usually get on these things and we all do it just in the chat, but I love to see people get to know them. I love some of the ones that you all mentioned. You talked about brushing your teeth. Well, I'm going to give y'all an example. I use an adapted toothbrush to brush my teeth. But I have a question for y'all. You can just say yes or no or thumbs up, whatever you want. Even though I used an adapted toothbrush, did we both brush our teeth today? I see Taryn's nodding. How about other people?
We have some yeses in the chat.
Some of you mentioned getting dressed today, and I hope we all did, because this would be a whole other training if we did not. So, yes, and it's okay to laugh. We want to laugh a little bit. Some of this doesn't have to be so some of these conversations can be stepping into the uncomfortable for some folks. So I want you to know some of it's okay to be a little lighthearted about, because we want you to enjoy it and feel like you can have dialogue and share as well. So I want y'all to think about, I got dressed this morning. I use a service dog, a button hook, and other adaptive equipment. I have elastic shoelaces in my shoes, some of them. Did we both get dressed this morning, even though I used assistive technology and a service animal to get dressed? Yes or no?
We have some yeses.
Awesome. I took a shower this morning and I used a grab bar, a shower bench, and a adapted sponge. And you all probably got cleaned up or took a shower too. Did we both take a shower? I'm assuming the answers are
Yes.
yes. All right, awesome. So that's where I'm pointing out to folks. A lot of people get lost in this definition that it means substantial limitation. That is not what they're trying to say. They're trying to say it's a protection under the law that allows people to have supports or reasonable accommodations to be successful. If anybody's taking notes, I'm going to give a note that you would want to keep in mind. Here it is. People with disabilities complete everyday tasks the non traditional way. And that's how you want to be articulating it. We don't do it different. We don't do it the not normal way, which is how our society likes to use these words, normal, different, because if you're applying that language to it, it is saying that people with disabilities are these different beings. We're not. We want to go to work. We want to be in the community. We want to have friends. We want to participate in activities. We want the same things everyone else does. We just carry them out in non traditional ways. And so by me using a grab bar, by me using a service animal, by me using my power wheelchair for mobility, I'm still doing the same things everyone else is doing. I just use non-traditional ways to carry those same tasks of daily living out. And then for you all, I hyperlinked it to learn about the ADA so that y'all who may have more questions could be able to look at it some more. The Americans with Disabilities Act is a civil rights law that was passed on July 26th of 1990. It was the first piece of legislation that allowed people with disabilities to have true freedoms and rights in this country. It is one of the only laws in our history that was written by people with disabilities for people with disabilities. So it was written by the people who use it. And that's a key instrumental thing. And on the screen, I have a picture of George W. Bush signing the ADA into law. And the person to his, I hope it's going to be the same for you. It is the person on my right who is in a cowboy hat. It may be on your left, but he is wearing a cowboy hat. And he is the grandfather of the Americans with Disabilities Act. His name is Justin Dart. When the ADA was passed, it was broken down into 5 basic titles. Title 1 allows for people to have accessible job announcements, to be given the opportunity for reasonable accommodations to interview, and then once you're accepted into a job, to have the right to request for reasonable accommodations and support on the job. Title 2 is public services. That's any state and local government entity has to be accessible and provide accessible services, accessible announcements, accessible emergency communications under Title 2. Title III is public accommodations and private entities. So this would be your malls. This would be your restaurants. This is anywhere we go in the community has to be accessible for all people with all types of disabilities and provide those accommodations to people with disabilities. Telecommunications under Title IV says that people with disabilities who have speech, communication, and hearing disabilities are afforded accommodations in emergency disasters, in things that are displayed to the whole country or a whole state or a whole community where they have captioning at the bottom of the screen. It also allows for something that takes place nationally. It's called 711 relay. And 711 relay, any of us can dial that number anywhere in the United States, and it connects you to a relay operator who will sign in American Sign Language to someone who is deaf or hard of hearing across their phone screen, a computer screen, a tablet. So if you don't know about that resource, 711. I often repeat it because sometimes people accidentally call 411 and they'll call me after the training, tell me they did 411 and it's 711. And then miscellaneous, the one piece I want y'all to take away from miscellaneous is that Title V allows people with disabilities who may have a concern about accessibility or discrimination to express that concern or file a complaint. And it allows providers or someone who has witnessed someone going through an accessibility concern or discrimination to support that person without coercion or retaliation as well. And that all comes from the Department of Justice. Any questions so far? I know it's a lot of information. Anyone have any questions? If not, I'm going to some other examples of daily living that the ADA uses to define. We have seeing, reading, any kind of movement that could be impacted, thinking, remembering, learning, communicating, hearing. A lot of people don't think about social cueing. There are people with disabilities like autism where social situations are very difficult and social cueing. And that is an example of daily living that can be impacted as well. And I hyperlinked any other questions about the ADA and daily living activities to it as well. So I wanted to talk about visible versus invisible disabilities as we're understanding disabilities. Some disabilities are visible, that we can see them. And you can tell that the person has a disability, like myself. Someone who uses a wheelchair, a white cane, or a service animal might be indicative that they have a disability. Some people have invisible disabilities or non-apparent, which means you can't tell. Examples include people with major depressive disorder or depression, learning disabilities, ADHD, autism, epilepsy, arthritis, traumatic brain injury, AIDS, and asthma can all be some examples of invisible disabilities. With that in mind, I wanted to let people know the majority of people with disabilities that you are going to encounter in your professional life, your community life, and your personal lives, only 2% of them are wheelchair users, while over the majority are invisible that we cannot see. Because I often hear from our communities and nationally when I do presentations that people are only providing accommodations or asking questions related to accommodations to people that they assume have a disability because they can see it. And realizing that a majority of people that you serve and come into contact with are people whose disabilities you are not going to know just by looking at them. I asked people with invisible disabilities to share some information that I could share at trainings to professionals and community members. And they wanted people to know just because you can't see someone's disability doesn't mean it's not there. and that disability affects people in different ways. And some people, we can have the same disability, but we have different accommodation and support needs. Now, it's really important that we are using the right classification for disability because it's connected to the reasonable accommodations or supports that people utilize. I will often hear in the course of my work people saying, well, they have a mental disability. Well, most people assume that means psychiatric disability. But if you delve deeper, sometimes people are referring to intellectual, developmental, and cognitive disabilities. Some people use it to talk about learning disabilities. It's really important that we're using the disability categories correctly because of how they link to supports that individuals may need. And I have another collage of pictures of people with invisible and visible disabilities in different community settings to show that we are a part of life, we are integrated, and we want to be integrated. So we have physical and mobility disabilities. These are disabilities where people use assistive technology like wheelchairs, walkers, crutches, canes, rollators, which are walkers on wheels with seats. Some examples of disability here could be multiple sclerosis, muscular dystrophy. Those are just a couple. Speech and communication disabilities are wide ranging. They can be from people who have aphasia, where they've had a stroke and their language is impacted. Can be people who have hearing disabilities who have some use of language and speech. Can be people who have developmental disabilities like myself, who may use augmentative communication devices. They look like a laptop, they're portable, you hit a button, it will either say a sentence, a word, or you can point to the visual and an automated computerized voice speaks to them. They can also have apps on their phones, tablets, and computers that do the same thing. Some people use communication boards, which are poster boards with visuals or words to let people know. And others may even use communication cards or sign language. So really being aware, it encompasses a wide-ranging amount of disabilities. Learning disabilities, all that means is that people learn information in a non-traditional way. Could be dyslexia, dyscalculia, dysgraphia, where people see words, numbers, and letters in the reverse. Psychiatric disabilities. This disability, everyone here knows, as we are all counseling professionals or have a counseling background, this disability has probably the largest stigma in the disability community. There's a lot of misnomers or falsehoods about psychiatric disabilities, but psychiatric disabilities make up a lot of different types. They are mood disorders, anxiety disorders, major depressive disorder or depression. We have people that may have other disabilities like schizophrenia or bipolar disorder, but it doesn't mean people aren't capable of living everyday community lives, which most of us probably know in the counseling profession, but a lot of others don't. Hearing disabilities are two types of disabilities. There's people who are completely deaf, who don't hear any sounds, and then people who are hard of hearing that may use cochlear implants or hearing aids to amplify sound. But they want me to stress to people when I do these presentations, they do not hear sound the way we do. It is nothing like that. They may read lips, they may use sign language, they may write information down or text it to you to communicate. Visual disabilities are three categories. You have people who have low vision. You have people, that means they need information enlarged or words magnified. It can be people who are what we call legally blind, where they only see lights and shadows. And then you have people who are completely blind, who may see nothing. We do have other disabilities that would fall into that, macular degeneration, anything related to the eyes. Intellectual and disability and developmental disabilities have the second most stigma attached because of people's what we would call outdated thinking. Intellectual and developmental disabilities are not solely defined by IQ. And we don't use language anymore like I'm high functioning, I'm mid functioning, or low functioning. Outdated. People often use those words to try to fit in with other people in society. They want you to accept them. Intellectual and developmental disabilities, people run Fortune 500 companies. People are in high levels of leadership with these disabilities. And so realizing IQ doesn't define people, people define people and who they want to be and what they accomplish. If you were to have looked at my IQ scores and looked at where I would have ended up, and if I could, I'm in my 50s, y'all, and so I have been around a long time, and I remember what it was like for people to have very low expectations for me. I am also one of the people who has been institutionalized. I was institutionalized as a child in the 1970s. If your biological parents could not take care of you, that is where you ended up. People thought I would be nothing. They made sure to tell me I would be nothing, and I should not have any high expectations for any life at all. I graduated college. Prior to this career, I was a school teacher for 12 years. I taught middle and high school English. I have a master's degree from Johns Hopkins University. I have spoken in front of Congress. And I only share these things with you, not because they're extraordinary, but to say people should not be boxed in of what you think they're capable of. People are capable. I worked very hard to get where I am today. And the reality is, other people with disabilities, no matter the category, can do the same. And you just have to give them the opportunity. Health disabilities are COVID-19 and other health disabilities. COVID-19 was declared a disability in the past year. And temporary disabilities are anything like a broken arm, a broken leg. If you have a surgery and you need an accommodation or support while you're healing until you're back to your everyday skill level. So I want you to know all of these disabilities and temporary are protected under all the laws, and they all are afforded accommodations or support under the law. Any questions about that? Any questions so far, Taryn, in the chat? Or anybody want to unmute and ask a question? Because I know this is a lot of information.
We don't have any questions, we just have a couple comments in the chat.
Sure, share some. I love comments.
So we have a participant, an attendee, just basically stating that they wear a prosthetic. And then another individual stated that as an HOH person who relies on hearing aids, thank you for saying that.
You're welcome. Woohoo! And prosthetics and people who are amputees or who have amputation, they usually fall under physical and mobility disabilities. So thank you for bringing that up. I appreciate that. So what am I trying to get at here? Disability impacts all of us. Currently in the United States, according to the Centers for Disease Control and Prevention, 61 million Americans have a disability right now. And these are people who have disclosed. So I want you to think how many people probably haven't disclosed. That number is larger. That means by the people who have disclosed disability, 1 in 4 Americans currently has a disability. And I gave you the information because y'all can look it up by state as well to see how many people in your state. In my state, we are larger than the national average. 1 in 3 South Carolinians has a disability currently. That's not a group that we want to lose. I don't know about you all. I don't want to lose all those customers and people that we can support and help find their dream and their way as well. So that's really important. So, what does that mean for all of us as professionals and community members? That disability is the largest minority group in the United States. Everybody hear that? Disability is the largest minority group in the United States, and the CDC has determined that. We're the largest minority group. And guess what? We're the least recognized when you talk about diversity, equity, and inclusion. And guess what's about to change? They're about to change diversity, equity, and inclusion. And it's going to become DEIA, diversity, equity, inclusion, and accessibility, because people with disabilities are the largest minority group in this country. And one of the things to be thinking about, we in South Carolina and our organization are working with the South Carolina Department of Education to help get disability rights and movement taught in schools. Most people have no idea that our culture and our background is as rich as the civil rights movement, and that the Black Panthers actually helped people with disabilities to get their rights. And there are whole stories of our movement just like that, that people just don't know. And if you're not uplifting a minority group that's the largest in this country, then you're leaving out a whole lot of people. And I encourage you all as professionals to really be thinking about that. How can you uplift disability and amplify disability equity in what you do every day? So I'm going to take y'all back a little. Okay. I want you all to think about when you were children. Everybody thinking? I know some of us it seems like long ago, others of you it may not have been as long ago, but I want you to think about your childhood. And I want you to think about when you first recognized disability, when you first had exposure to disability. And what are some things that you can remember about that? I'm going to start so everyone will know where I'm going with it. My first memory of my disability is when I first went to school. Okay. I am a child that was around before we had laws that integrated people with disabilities. So when I first went to school with people, I could only go to school with people with disabilities. The law did not allow for us to be integrated. So my first memory of disability was exclusion, because I couldn't go to school. I was adopted by my parents when I was 7, and I went to court to testify for that. But I remember being like my best friend, Jill, that lived next door. We couldn't go to school together because Jill didn't have a disability and I did. And she wanted to ask her parents, why can't she go to school? She comes over to our house after school and on the weekends. What do you all remember as your first thought about disability or your first experience with disability? You can either put it in the chat or feel free to unmute if you just don't feel like typing. I love to hear from everyone. What do you remember as your first experience with disability or people with disabilities?
Hi, Dori.
Hi, Olivia.
I'm going to jump in. I'm how we should put this. I'll put myself on the screen just
Sure.
because I know that some people lip read. I am an individual with hearing loss. I am also a licensed counselor in New
Woohoo.
Mexico and Nevada. And so my life story has shaped me as a counselor. And I can remember as a child being the last one picked in PE, last one picked in PE. And I just remember exclusion. I remember kids bullying me. I remember one kid touched my hearing aids, and I didn't ask for that, but he said he's going to play magic tricks with it. And I was like 13. And as a 13-year-old, you're learning your attraction to boys. And I was like,
Hmm.
I don't think boys are attracted to me. And so that was my first experiences as a child, feeling like socially I wasn't accepted.
Thanks for sharing that, Olivia. I greatly appreciate that. I say that I know it takes a lot to share with people we don't know so well. So thank you so much. Anybody else want to share?
I'll share again. I hope that's okay.
Yeah, go,
um,
Allie.
my grandma's sister, my great aunt, had Down syndrome, and of course that was a long, long time ago. But my great grandparents were like beyond their time, and they refused to institutionalize her, even though they were told to. And so she
Mm-hmm.
lived at home for all her life. But of course, by the time I got to know her and I was a little girl, her parents were long gone, and so she lived in an institutionalized setting. But my family visited her every week. And so then I got to know her and all the people she lived with. And I feel really lucky because I feel like it gave me such a different view
Mm-hmm.
um, of knowing and loving somebody who had a disability. And then later in life, I also had hearing loss and had to wear a hearing aid. And so in my work, all the stuff, just like nice
Yeah.
pathway.
Thanks, Allie. I appreciate that. Is there anybody else who wants to unmute? If not, I'll have Taryn share from the chat so I don't miss anybody. But thank you both for sharing. I greatly appreciate it. Taryn, you want to share any in the chat? I saw
Well,
the numbers going, so I know some people put some things in there.
yes, we have message or memory of don't stare. We also have memory of recalling their grandfather with their cane and how hard it was for him to navigate certain situations, especially stairs.
Mhm.
Another story of unusual praise for befriending a person with a disability, um, as someone who did not have a disability as a child.
Mhm.
Another experience here of a high schooler who had a head injury was
Mhm.
told to sit with the little kids who were at the front of the school bus.
Th-
Um,
these are great examples. Any more, Taryn?
yeah, there are quite a few here. So
Okay, well, why don't we encapsulate that? Only because y'all, I don't want us to run out of time. But these are great answers. So I'm sharing with y'all. A lot of us learned separate, and I'm going to give some other examples for those who may not have felt comfortable sharing, or I bet a lot of you remember that people with disabilities, they rode a separate bus. If you're probably in my age range, people with disabilities being in separate classrooms and separate activities. So we're kind of taught at an early age and may not even realize that it's subtly ingrained in us that people with disabilities are thought of as different. We're different beings. We don't want the same things everybody else does. We don't do things the way everyone else does, and that we're separate. So I'm going to ask you all in a nutshell, are we, not you as individuals, are we as a society taught to be empathetic toward people with disabilities or disability, or are we taught to be sympathetic overall as a society? Which one do you think is taught to people without them realizing it? It's taught. Do you think we're taught to be more sympathetic or empathetic? And you can tell me, Taryn, what people are putting in the chat.
largely sympathetic has entered into the chat.
Yeah, and that's really, I mean, some of us who were fortunate to be exposed to people with disabilities early on may have that empathetic, but a majority of our society has been taught sympathy. And sympathy then leads to other barriers of attitudinal barriers for the disability community, which I'm going to illustrate coming up. But I talked to people with a wide range of disabilities in all categories that I shared with y'all. And I said, what would you want professionals working with people with disabilities and community members to know. And they said, I want people to know we are not tragic or pitiful. We're not helpless. We're not angry or vengeful overall. Some of us might be adjusting to our disabilities if they're new, but we don't feel angry because of that solely. We're not stoic or brave. We do not want to be inspirational beings. We are not all alike. We may do things the non traditional way. We may see our disability as part of our self identity. I do. I heard some of our other friends, like Olivia, it's part of who we are. We are proud. It's a part of our culture and our self identity. And we have the same needs, talents, and desires as everyone else, and we deserve the same opportunities as everyone else, and we want those opportunities. I have differently only on the slide, y'all, because I have some folks who take these professional trainings who need plainer language words, and there really isn't a better word for non-traditional. So, but we want you to realize people with disabilities, we are not different. We are like everyone else, and we want the same opportunities. There's always exceptions to the rule. There's exceptions in the non-disability community too. Not everybody is going to be the same, and that's okay. We may have the same, we may have different accommodations or support. Some of us may use our physical voice to communicate, while others may use sign language, augmentative communication devices, apps, and boards. We all do not have the same personalities. I am very gregarious. I have some of my coworkers who would tell you they are introverted and they do not want to be like someone who would be out doing a lot of front facing work with the community. And then we do tasks in the non traditional way. Even if we have the same disability, we may carry out the same task, quite the opposite. Disability and people with disabilities are marginalized, okay? Which means that we face bias. People usually don't associate disability with human rights, and that marginalizes us as a community. They don't often provide access to services, programs, and accommodations and offer them, which marginalizes us. There's a real paternalistic view still in today's society where we want to overprotect people with disabilities. And we have a saying at Able, South Carolina that we spread all across this country. People with disabilities have the right to fail. I bet a lot of you have failed. It's how you learn to strategize, problem solve. You learn to try things differently. If you take that away from people, you don't believe they should be included. Because inclusion is the good, the bad, and the ugly. Dori's had her heart broken when she was younger. Dori made mistakes, and guess what? I got back up and I was successful. If I hadn't been given those opportunities, I wouldn't have learned how to problem solve. I wouldn't have learned how to strategize. And I have a significant developmental disability. So when people tell me people with intellectual and developmental disabilities can't go through that, that's incorrect. That's people's assumption that you cannot handle failure. And that is not true. Systemic ableism further marginalizes us. Perceptions that our life is less than because we have a disability marginalizes us. Low expectations. Do you know that people with disabilities in self-contained classrooms where I live in South Carolina and in many other places across the country are not given information on healthy relationships and sexual education? So you have people out there who are uninformed, who are still going to partake in intimate activities, but they don't know what that looks like. That's because of that idea that we're asexual beings that cannot participate, and that's incorrect. You just have to adapt the information and make it accessible. When we marginalize people with disabilities, we further isolate them, further exploit them, and which ultimately leads to more marginalization. And then segregation is a part of marginalization. I want to point out to people, separate is not equal. It isn't. It's just separate. So saying, well, we're going to offer a special counseling group for people with autism, that's separate. That isn't equal. They should be receiving and taking part in the same activities, but implementing the right accommodations and support. I will tell you, I get a lot of calls for that in South Carolina. Here, people won't let me participate in their counseling sessions, whether it's for violence, mental health counseling, or other types of counseling. And they're like, why aren't they asking me how I can participate? Why is the assumption that it's easier to provide me something separately? The law says integration. If the law says if I ask to be a part of, when I say I'm representing the I of the whole disability community. The disability community requests to take part in something you offer everyone, you give it to everyone in an equal way, not a program separate for people with disabilities. Not talking about individualized counseling, because that would be individualized. Diversity and intersectionality. Disability intersects with all community groups, which is why we're the largest minority. We intersect with the BIPOC community, Black, Indigenous, people of color. We intersect with the LGBTQIA plus community. There is no one size fits all approach to working with people with disabilities. And as I mentioned earlier, two people with the same disability may have significantly different needs. And we're adaptable, because one of you said that beautifully earlier, and I was so happy to hear it. People with disabilities are resilient. We're resilient people because we're adaptable. We've grown up in a world that was not created for us, and we learn to adapt at an early age. And when we're given the right supports and accommodations and program modifications, we can be even more successful and can partake in any activity that's offered to the general public. So how do you check to see if you have implicit bias toward disability? And I'm just going to tell y'all, we all have implicit bias. There is not one human being on the earth that doesn't have some kind of bias. It happens because we're taught and conditioned with certain beliefs from childhood that get in there. Often we don't even realize they're unintentional, that it's taking place. So here's how you check your implicit bias toward disability. Ask yourself, when you think of a person with a disability, do you focus on the things the person can do or can't do first? Are you sitting there thinking they're not going to be able to do this, they're not going to be able to do that, they're not? That's one. Check. Because if you're thinking that first, then there must be some bias there. Where did you get the information on which you based your views? Did you ask or observe the person with the disability? Did you ask people with disabilities how they would be able to do it? And when you meet a person with a disability, or you find out they have a disability, do you automatically assume they're going to need help? It's something, y'all, I have to check myself all the time. And I'm a person who lives marginalization. So I'm sharing with you all. And why do I say that? Because there's more marginalization with disabilities. Then I'm also a woman. And then I'm marginalized because individuals in the intellectual developmental disability community have more marginalization put toward them as well in the disability community statistically. So imagine if you're also a member of the BIPOC community, you're a member of the LGBTQIA plus community, and you have disability. Imagine the amount of bias you are incurring every day in your life. It's a lot. And we share that because it leads to the barriers that people with disabilities face in trying to access not only counseling services, community services, employment services, healthcare services across the board. I'm going to share with you all the top barriers for people with disabilities in partaking in community life, whether it's counseling services, healthcare, education, employment, you name it. The very top one is attitudinal barriers. The idea that people with disabilities are less than, we're not capable, and we're people who need help. It stops us from a majority of things because people think we can't do it. Communication barriers. That's anything that prevents any individual from receiving or understanding information and ideas that are being shared. So if your website is not coded correctly for accessibility, how do people use your services and learn to find out? If you're not putting documents that are coded with a rich text format, that is the coding for documents. They have to be done in a particular way. If you're having an event and you're not using sign language interpreters, and people may need that. If you are not using plain language, which has become a national movement and becoming a requirement under the ADA, that means putting words in easy to understand language. Do y'all know that the typical American reads at a 6th grade level? 6th grade. That means plain language would be a universal designed method of communication, because not only will it benefit people with disabilities that need it, but it will benefit the general public who read at a 6th grade level as well. Physical and architectural barriers or structural obstacles in a person's environment that interfere with mobility. Who can tell Dori? This is the one people never have trouble with. What are some physical and architectural barriers, my friends? Name some. You can unmute or put them in the chat. What are some architectural or physical barriers that people with disabilities could encounter in our communities or our offices? Anything?
Not having hearing loops, especially
Yes.
within the counseling setting. For example, one of the things that I'm working on is like having accessible clinical areas where there is a hearing loop, not only for the therapist that it is has hearing loss, but also for the client, so it works both ways. There's not any of that within the United States, to my knowledge.
Awesome. So having more options for hearing loops, etc., because a lot of people use what we call FM communication devices to attend events and such, where it will caption or amplify sound. So that's great. Thank you for sharing that, Olivia. Do we have other people who have some examples?
While we're waiting, Dori, we have a few here in the chat.
Thanks, Taryn. I appreciate it.
Yes. Stairs, heavy doors, crowded ramps, narrow doorways, broken elevators with no other option to get to the meeting, and narrow doorways or small hallways.
Awesome. Those are great. Not awesome that they exist, but awesome answers is what I mean. So thanks, everybody. Fabulous. This is another one that is a large barrier for people with disabilities and community integration. It's called policy barriers. That's where, I don't know if all of you know that the ADA, the Rehabilitation Act of 1973, all healthcare laws that pertain to healthcare require you as a provider to have a policy for serving people with disabilities that includes how you're going to provide reasonable accommodations, or the plain language word supports, how you're going to have your programs and activities that you offer under your programs to people with disabilities. You have to have a policy in place. People can lose funding for not having that. And I say that in a kind way to people because I don't want people to be in a sticky situation where that happens. I want you to be able to provide services and the community be able to access them. But a lot of people don't know that. And then something may come up where somebody requests an accommodation. They'll say, I would like to see your policy on that. And sometimes people say, oh, we don't have a policy. And then the Department of Justice may intervene and they're going to ask you where that is. Or the Affordable Care Act also requires it, the ACA. The Rehabilitation Act does healthcare if you get any federal funding. The ADA is state and local. Hospitals and telehealth requires it now under current ADA laws. So I just wanted to make sure y'all know this, and I'm sharing it in a caring way because I want to make sure everybody has it in place so you're not put in a sticky situation. If you don't know how to do that, and you need help with that, please reach out to me after the training. We have a whole team that's trained how to do that: website accessibility, policy accessibility. We are all not only people with disabilities, but we all have all of the certification required under the Americans with Disabilities Act and other technical assistance to do it. So if you need help, better to put it in place and have it than to be out there and you don't, and then something happens and it could put your financial practice or funding in jeopardy. It's not worth it. Transportation, we all know there's a lack of adequate transportation in this country, especially in rural areas, which impacts a person being able to access community services, healthcare, medical, counseling, etc. Programmatic, these are any reasonable accommodation. If you're not providing materials and accommodations to people, how can they truly partake? They can't. Examples might be not allowing someone to bring a personal care attendant to their counseling session, not using plain language. These are all examples. If you don't have a sign language interpreter, your forms they have to fill out in digital formats for people like me who can't physically fill out the form because my hands are also impacted by my disability, which is why I use voice to text software on my job and in my personal life. It makes a difference. And then digital, I kind of captured this already, but electronic content that is not accessible for people with disabilities. It's not screen reader technology friendly. There's no captioning. You have a video on your social media and there's no caption or sign language interpreter in the video signing it. How would someone be able to use it? How would someone know what it is? And that's so important because people want to participate. The largest attitudinal barrier is ableism. And ableism is a national term. It's discrimination and social prejudice against people with disabilities and or people who are seen to be disabled. It's, again, when you presume a person is less than because of their disability. There are two kinds of ableism. There is ableism where non-disabled people view us as less than, and then there is internalized ableism. Internalized ableism is when a person with a disability sees themselves as less than and not capable. And there are a lot of people you all may see in the course of your counseling work that have internalized ableism. That means they don't have disability pride. They are not confident as a disabled person. Who wants to tell me, where do you think internalized ableism comes from? How do you think people develop internalized ableism? You can put it in the chat or unmute. How do we develop internalized ableism? Where do we think that comes from?
The general
Olivia?
society.
Hi, Dori. I know that I developed it from school, the messages I saw from school, and as well as what I saw in the movies. I didn't see anybody like me. until like last year when I started getting more into disability research and mental health. I noticed that there were just a few professors and researchers with disabilities, and that bothered me because I'm like, wait a minute, there's nobody like me writing the research, and even when you submit it gets rejected. So I'm still working through some of these internalized rejection. And so it's an ongoing life journey. And I think that you're right, within the counseling field, it's so important in mental health and rehabilitation, partnering together to work with clients on those internal messages that come from childhood and even continue to pop up in professional life.
Thank you. Anyone else want to share where we think internalized ableism starts? And I know some people put it in the chat, Tara, and I just was checking y'all with the people first to unmute themselves so it wasn't more confusing for Taryn. All right, Taryn, did people put stuff in the chat?
Hey, Dori, this is Rita. I have something to say.
Oh, I would love to hear it.
Yeah, okay. I think a lot of it begins at home.
Yeah.
It's just so easy for a parent, they have, because I see this or hear this all the time from my consumers who are blind or low vision. Oh, my mom takes care of all this for me. Well, that's wonderful, but mom's not always going to be around, or my husband or somebody, somebody's going to do it for them.
Yes, so
Or
that we call that enabling. That means
yeah.
putting yourself in between someone and their life consequences. That's not a good thing if you enable
Right.
someone. I'm just
Right.
sharing it for everybody else, Ruth, because we talk about that a lot here in South Carolina in the work we do, but we're spreading that more in our national work and international work as well. Well-intentioned people enable someone. But people
Right.
with disabilities, we don't have someone that's with us 24/7, 365, and no one lives forever. So if we're not empowering people versus enabling them, we are going to add more barriers to their life.
Right. And another thing too is the individual wants to do something, and rather than taking the time to show them how to do it, oh, it's just easier if I do it myself. Oh, I can do it myself. It's like, well, take the time, find a time when you're not so busy, and then show
Thanks.
them
I'm
how to
giving you a
do it.
fist bump in the air because that's
Fist
often
bump
the
back.
dialogue I'm having with people,
Yeah.
families, especially of young adults with disabilities who want an adult, but young adults, teaching them if you want people to be self-sufficient, sometimes you have to let go. It doesn't have to be perfect. It doesn't have to look like the way you do it. And if you don't let go, what's going to happen is they start to question, am I capable? Am I worthy? Am I able?
Right. Exactly.
Thank you for sharing that. Awesome.
Oh, you're welcome.
Awesome.
Dori, Dori, you brought up something that triggered me with, when I think about this, that internalization also of yes, we need to be able to do things for ourselves. And I can remember my family doing stuff for me, but then I got to a point where it's like, I can do this. I'm growing. And but there's another thing that individuals with disabilities live with is that perfection. Nobody's giving me this chance. And so when they get it, it's like, I'm going to do this perfectly. I'm going to do this perfectly. And so it's almost like you also develop that imposter syndrome too.
Yes, that imposter syndrome is real. It is. Taryn, what do we have in the chat? And then I'm going to go to the next slide.
Yes, we have just an overall theme of society and social media, upbringing within the family, and lack of representation in media.
Love it, you guys. Woohoo! I'm going to give you all some examples of what ableism looks like. It's unintentional usually, but it happens. We should feel sorry for people with disabilities. People with disabilities, they have a poor quality of life. Individuals with invisible disabilities, they're faking it and they should try harder. So they go to ask someone for an accommodation and somebody goes, well, you don't look disabled, you don't need it. Assuming an individual can't do something without thinking about what supports could help them first, or asking them what supports could help them first. People with disabilities shouldn't have children, or people with disabilities with certain categories of disability shouldn't have children. People with disabilities, we can't make decisions for ourselves. We should not be able to make decisions for ourselves. And that people with disabilities can't work, don't want to work, and should only work in certain jobs. Who wants to guess what job I was offered, even though I had multiple degrees? What job do you think I was offered by the community? Anyone want to take a guess? And these are knowing that I had multiple degrees. What job do you think people thought my personality would work well with?
We have a chat here that says greeter.
Yes, you got it. Woohoo! If I could give prizes, I would, but I work at a nonprofit. I'll just give you a woohoo instead. Yes. Ableism leads to inspiration porn, not pornography, but like pornography, disabled people being objectified. This is where we use images, videos, and memes of disabled people used to motivate non-disabled people, suggesting that if a disabled person could do it, then obviously a non-disabled person could. Looks like this, my friends. We put a child with prosthetics and then we say your excuse is invalid. We make people with disabilities out to be brave, inspirational beings for signing their name or doing an everyday task that we're all required to do. And then we have what's called a yes prom. It's where a non-disabled person asks a disabled person to the prom or any kind of activity, and it's all over the news and social media, and making the non-disabled person look heroic because they were a friend or a boyfriend or a girlfriend or a partner or a spouse of a disabled person. It's dangerous. This causes most of us to have ableism because we're trying to take people with disabilities and make them into these inspirational beings, and we don't want to be that. We want to be everyday people like our peers who do everyday things. I'm not inspirational because I sit in a wheelchair or I have non-traditional ways of thinking. Because that's what you're saying. When people tell me, Dori, you're so inspiring. I'm inspiring for sitting in a wheelchair and thinking in a non-traditional way. No, you might be motivated by me, but it's not my disability. It's my fortitude or an aspect of my personality. So you want to be careful. There's a great, if any of you want to write it down, Stella Young has a great podcast. It's humorous, not podcast, has a great, it was a TED Talk that was done. And Stella Young talks about inspiration porn. She was also a comedian, so it's really well done. If you go to YouTube, type Stella Young and I'm Not Inspirational, it's called. Great example. So the disability community uses different types of language to connect our identity. We want y'all to know, first off, disability is not a bad word. Without the word disability, we are not afforded legal protections to help us have reasonable accommodations or support. So we all need to get that thought out of our head that it's a bad word. It's not. It's only ugly if you think it's ugly. Disability is a part of our identity. We are called the disability community. We have disability culture, and it's something that we're very proud of. We want people to start realizing that you need to use the word disability rather than using offensive terms like special needs. Why is special needs offensive? I'm going to tell y'all why. Special needs was created by the educational community, not the disability community. The disability community, nationally and internationally, has asked the education community for over 10 years to get rid of the word. They have chosen to ignore the disability community. who is telling them it's offensive because it implies that we're special compared to other people, that our needs make us more special than other people, and we're not. We're everyday people. So what do we say instead? Students with disabilities, students without disabilities, disabled students, non-disabled students. Handy-capable, physically or mentally challenged are euphemisms. They are also seen as offensive to the disability community nationally and internationally. So staying away from that word, those words. Differently able. I'm going to tell y'all this is supposed to make you laugh, so please take it for the humor it's meant. We, as the disability community, nationally and internationally, want to know what that means, because I can't read minds, I can't levitate. How am I differently able? No, I have the same abilities as everyone else, as does the other members of the disability community. We just carry our talents, abilities out using non-traditional tasks. And if you keep calling us different, what are you saying to the world at large? That we are different. We're not. We're like everyone else. Disability is a part of the human experience, and it's something we should be proud of. So there are two types of language used to talk about disability with people with disabilities, and they're recognized under the ADA, and you can be audited for using outdated language. Person first language describes the person first, and the disability is just one aspect of the person. We say person with an intellectual disability, person with a physical disability, person with a psychiatric disability, person without a disability. Then, about 10 years ago, the disability community decided to reclaim disability by embracing our own language, which is called identity first. And it positions disability as an identity category. It's showing the non-disabled community that disability isn't something we're upset about. It is a part of who we are, and we're a proud part of who we are. So we use words like disabled person, autistic person, neurodivergent person. You all are going to receive a packet from ARCA, from me, that you can share. You can make copies of it. We created a packet from the National Council on Disability on the most updated, relevant disability terms with some historical context of why some words should not be used anymore and why to stay away from them. So y'all are getting more information that I could put on 2 slides in a packet that will come to you with the PDF of the PowerPoint and another handout when we are done. Programmatic barriers are anything I said, y'all, where we're not allowing people to use reasonable accommodations. So I wanted to go over some things you should think about. Are your materials available in alternative formats? Braille, large print, audio recording, plain language? Does your front desk staff know how to communicate with walk-ins who are deaf or hard of hearing? Do you have practices in place to de-escalate situations if someone becomes frustrated? That has nothing to do with any type of disability, but picture the person who took 3 buses to get to your location in the pouring rain. They slip outside with their crutches. They come inside and they say, I'm here. Do you have this reasonable accommodation and support? And you say no. So thinking about how are you going to ensure that you don't have those situations happening? Do you have a policy about service animals? That's required under the law as well. Can someone who uses a screen reader fully utilize your website? Do you know how to communicate with someone with a hearing disability through either a sign language interpreter or video relay services? And we always tell people, be prepared to think outside the box. But most importantly, ask the person with the disability that you're working with, because they could give you the answer. So I had this situation: an individual enters your organization who is deaf. Who can tell me, what are you going to do? What's the first thing you're going to do? And I have a picture of an individual in a blue t-shirt with long black hair doing a sign language sign. What are you going to do if somebody walks into your office and they're deaf? And you can tell me in the chat if people put things, Taryn.
At this time, we don't have anything in the chat, but I encourage you
I'm going to tell y'all what you're going to do. Everybody always usually tells Dori, we're going to get pad and paper, we're going to get this or that. You're going to ask the person with the hearing disability what accommodations they need before just jumping in. Let them guide you. Some people read lips. Some people write it down. Some people want to email you. Some people want to text. Some people do want a sign language interpreter. So you want to check with the person first before you do any accommodations. Let them guide you on what will work best. I wanted y'all to see, though, look at the number of auxiliary aids and services for communication for people with disabilities. We've got assisted listening sessions, instant messaging, text messaging. These are all services allowed to a person under the law, okay? And they're under the Affordable Care Act, under all healthcare laws. I just documented it to the ADA, so if you wanted to look at it easily. You want to make sure that your documents are coded and digitally accessible, that any pictures you have alt text. That's where you have to describe it, because not everybody can see and they use their screen reader to see what's on the screen. You want to make sure your websites are accessible because they have to be formatted in HTML or RTF, in addition to PDFs. So you want to make sure we give guidance on how to do that too at ABLE. So if anybody's interested, reach out after the training and I can help you out. Y'all did good with knowing what architectural barriers are, but I gave you some things to think about. Do you have ADA compliant accessible parking spaces that are clearly marked? Does your building have functioning automatic doors? Do the doors utilize lever handles instead of knobs, which people can't turn as easily with mobility devices or hands? Is the pathway free of plants and other barriers? Is the front desk low enough for someone in a wheelchair or who uses other assistive technology or equipment to access? Are your signs in Braille signage? Can we find the accessible entrance? Is there a sign telling us where it is? Do the fire alarms utilize flashing lights for people who are deaf or hard of hearing? Are bathroom stalls large enough for wheelchair users to maneuver easily? I'm going to share with y'all, sometimes people paint a sign or put that accessibility symbol on there, but it might not be compliant. They may never have measured it to see if it is. So you want to make sure before you tell someone we have an accessible restroom, there are standard guidelines under the ADA that make them accessible. That somebody could have easily, I know so many locations across the country where somebody painted a sign or hung a sign on the wall, but they didn't check that it was indeed accessible. And then at the end of the day, how you provide accessible, inclusive services are making sure if somebody needs assistive technology or AT, which is any piece of equipment that is used to maintain or improve functioning or independence. It allows people with disabilities to be empowered, and they don't have to be formal equipment. I use an index card with directions on how to do things sometimes to help me with my processing. That costs 50 cents, y'all. It's not all expensive. The average accommodation costs $0. And the most expensive, a study did last year, is the most expensive someone utilized was $500. And it's very few people where you're spending that kind of money. At the end of the day, how can you all uplift and amplify the disability voice? You did number one today, disability culture training, recognizing that people with disabilities may need individualized support and accommodations. Your counseling with them may take a little bit more time because they may need supports and accommodations that allot for that. considering all the intersections of disability as you're working with people. One of the key things I would stress to y'all, partner with disability-led community organizations like Able South Carolina that represent specific populations of disability. Include disability in all aspects of what you do, your clients, your consultants, your funders, your partners, your employees, your board members, and the planning of your everyday work. And be willing to learn from people with disabilities. They are the best experts on what they need, and they can tell you what supports work best for them. So as we're leaving and as we're finishing up, and I have my contact information and questions at the end of this, but I'm going to stop sharing so I can see everybody because you're all like small boxes. But could everybody say or type in the chat, what's one thing that you all think you can do after this training today in the course of your everyday work or in your community partnerships or relationships? What's one thing that y'all think you can do to improve accessibility or uplift disability in our culture and in our communities? You can put it in the chat. You can unmute yourself. What's one thing y'all think you could do? Can anybody, I can't tell to the chat. Raise awareness of the concept of ableism. Thank you, Deborah. I'm giving you a woohoo. That is a big one. Advocacy, yes. Advocate. What else? Can y'all think of something you learned here today that maybe you can incorporate into your everyday work? Test accessibility of websites. Thanks, Chris. Anybody have anything else? Be a positive support. Yes, that means don't do inspiration porn or ableism, but uplifting, using universal design. Share some of the resources. Awesome with your practices and organizations. Can anybody think of advocate, revise website? Woohoo! Support organization using the correct language. The other handout I'm giving you all is I told you all the different categories of disability at the beginning of the presentation. You were getting it's a front and back handout that has strategies for interaction and providing tips for supporting people with a variety of disabilities. Things that you can do easily that don't cost money. One of them is breaking down concepts for people with intellectual, developmental, and cognitive disabilities. I'm just giving you one that's in the handout, but I broke it down by category of disability, and then I gave you easy tips for each category of disability. Anybody have anything else I didn't pick up, Taryn?
I think you captured everything, and we would just like to, provide our sincerest gratitude to you, Dori, for this wonderful and meaningful presentation on rethinking disability culture, and equity. And Dori, we are most grateful for your work, contributions, and advocacy, and for taking the time to share all of that with us today.
Oh, you're welcome.
Yes.
In the PowerPoint that you're getting, the digital version, the PDF, it has my contact information. If anybody wants to talk about anything in more detail, I realize an hour and a half, it's a lot of concepts coming at you, and you might want to absorb some of it. I know I do a lot of times. And then also just the other thing I would share as I'm closing this is to think about ways that you all can uplift and amplify disability by celebrating disability cultural events within what you do. October is National Disability Employment Awareness Month. October is Disability Awareness Month. July is Disability Pride Month and the celebration of the Americans with Disabilities Act as well. Do y'all know we've only had rights in this country for 33 years? That's it. That's not very long. But ways to do that would be really, really phenomenal. And if any of you want help with the accessibility components, we do that. It doesn't matter where you are in the country, we help with that. We also, if you want other training like we did today here, you can suggest topics on the survey they're giving you to do in the chat right now. And then also, if you're looking for this presentation for any of the groups or your businesses, please reach out, because we do these things not just here, but in other agencies, groups, and companies at staff development and things too. So thank you from the bottom of my heart. I love the counseling profession. It's near and dear to me, being a counselor myself. So thank you all so much for being here today. And I hope we can meet up sometime. Reach out. I'd love to get to know y'all better. So thank you so much for your time today.